Welcome to Health+Tech, the show where we explore the law that applies at the intersection of healthcare and technology. Your hosts, Andrea, Linna, and Kristen Woodrum, are healthcare attorneys and partners at McGuireWoods, LLP, a law firm of over 1,000 attorneys with offices throughout the United States and the world.
Hi, everyone. Welcome to Health+Tech Podcast. I'm Andrea Linna. I'm a healthcare attorney and partner at McGuireWoods and one of the co-hosts of the Health+Tech Podcast. I also help lead the digital health innovation and technology subgroup here at McGuireWoods. I'm thrilled to not have one, but two amazing women on the podcast today. I have a new co-host, Kristen Woodrum. So Kristen is a fantastic attorney and inspiring female leader. Kristen, can you tell us a little bit about yourself?
Sure. Thank you, Andrea. I'm Kristen McDermott Woodrum. I am a partner in the healthcare department of McGuireWoods. I am based in Atlanta, but today I'm in beautiful and sunny Chicago. I focus my practice on helping providers and investors in all areas of the care continuum. And I especially like the challenge and fun of helping stand up innovative and new care delivery and payment models.
That's awesome. Well, excited to have you as a co-host.
Thank you.
We look forward to recording many podcasts. And then I'm thrilled to have Sara Teppema on the podcast. She is from Wildflower. Sara does some impressive and important work in the healthcare equity space, and it's been really fun to talk to her a couple of times in prep for this podcast. So excited to have her share her thoughts and ideas with the audience. So welcome, Sara.
Thanks, Andrea, and thanks, Kristen. Great to be here. Thanks so much for having me on the podcast.
Yeah, so if you could introduce yourself, Wildflower, your work, that would be fantastic.
Sure. Yeah. So I'm an actuary. Have you had an actuary on your podcast yet? Am I the first? Oh, I'm so excited. I get to be the first. Okay, good.
This is historic.
So I've been a healthcare actuary for about 30 years, actually longer. In the past decade or so, I've spent my time focused on value-based care and working with providers and how risk shifts between payers and providers. And I got into that because I really saw the need, working in both employee benefits and then in the payer world, see the need for providers to responsibly be taking on more risk. And then, we're seeing this proliferation of risk-bearing entities. So it's really exciting time to be an actuary in this space. I joined Wildflower earlier this year, and I was a consultant to Wildflower before that. And the reason that I got hired was we were brought on as consultants to design a custom bundle of care for Wildflower. I'll talk about that more in a little bit. So there's a lot of reasons that they needed a customized bundle of care, but we were able to kind of bring a data-driven model that helped us understand the best way to shift the risk in a way that would be, we think, appealing to payers as well as providers. So anyway, Leah, our Wildflower CEO and founder, asked me to come on board. And at first I said, well, I don't know if this timing is right. And then I said, wait a minute, I don't want to give this role away to somebody else because this is just too exciting to be part of this journey. Wildflower, just to talk a little bit about us, we are a women's health value-based care enablement solution and a digital health solution. We have a digital foundation that activates women and helps them and their families connect to care. We've started out with pregnancy, but we're quickly expanding into all women's health, which is really very exciting. We began 10 years ago, actually, so we've been around a while, but we've just been an app for pregnant women. And in the last couple of years, we've gotten funding to build out this value-based care solution. And now we're bringing in health advocacy and coaching, remote patient monitoring, a virtual care network to help fill in all the gaps, for example, rural gaps or even urban gaps that are more access gaps. And then also a lot of really beefed up content in our app. And so the goal is to sit between the payer and the provider and enable patient engagement and enable a full suite of solutions that help women really manage their care and especially their pregnancy, which is where we're starting.
Yeah, that's awesome. I was telling Sara I just had a baby, so I'm like super pumped about this application, this company, because I realize now just how incredibly important it is and what a big journey that is, especially for the first time.
Yeah.
So I know you are passionate about health equity. So can you talk about how digital health can positively influence health equity?
Sure. And I could talk about this topic all day. But I'll so jump in if I start to go too far. But really, when you think about health equity, it's about addressing people at the point of need and what they need, not necessarily giving everybody the same thing, but giving everybody what they need to have the same outcome. And so it's a pretty important distinction. And I don't know if you guys are familiar with there's a Robert Wood Johnson Foundation graphic with the bicycles. Have you seen that? So basically what it shows is,
no, I haven't.
Okay. So there are four people. There's a child, a mid-sized person, a tall person, and a disabled person. And they're all given the same bicycle. Well, only one of them can fit that bicycle. But in the next picture, you see that's equality. They all have received the same bicycle. But then the next picture, you see four different bicycle styles. There's a little child's bike. There's a really tall person's bike. And then there's like the disabled person, I'm blanking on the name, but the bike that somebody who, can power with their arms. And so that's equity, because everyone is getting what they need to have the same outcome. So anyway, I've used it in presentations and I've seen it used a lot in conversations, but it's a really great way to illustrate the difference between equality and equity. And so I guess when I think about, equity for pregnant women, this really means a few things, and, would love your thoughts on this too. But, the biggest thing that we're hearing is that patients don't feel listened to. And, this is particularly true for women and for women of color, especially. And so, the medical community, there's a lot of, I don't know if you've seen articles lately about medical gaslighting, but there's a lot of literature about this now, and women just don't feel like their providers listen to them. And so that's a big, big issue with equity in terms of getting people what they need, because if you're not listened to, you can't get what you need. I would say also related to equity is addressing the needs of women in the context of their social factors. So, they miss a prenatal appointment, and a provider practice could have all sorts of preconceived notions about why that is. They don't care about their child, or they whatever it is. And maybe they just couldn't find a babysitter for their older child. And maybe that visit could have been done via telehealth very easily. They didn't have to see them in the office that day, but the patient didn't realize that. So they just blew it off, So, there's a lot of, you need to understand that social context. And I would say too, just understanding what's blocking their way. Maybe they needed transportation to get to that visit, or, maybe they don't understand because their English is not their first language. And so what's blocking the way for them to understand what it is that they can advocate for themselves? And so can we help them to advocate? Can we help them in their language, in their context, based on their education level? Can we help them address all of the things that are blocking right? Give them the right size bicycle so that they can do it themselves. And then I think too, we're going to focus on that, the 80-20 rule. We're going to find the women that are really particularly in need of help, managing hypertension, managing gestational diabetes. Can we get them remote monitoring for their hypertension, blood pressure cuff at home? And when that blood pressure cuff goes off and gives us an alert, can we get that to the physician practice right away so that patient can, be monitored more actively in the office? We're not performing medical care, Wildflower, but we are enabling it to be easier for both the provider and especially for the patient. So anyway, in terms of equity, that's how I see it. I don't know if you have other thoughts on that, because I'd love to hear.
Yeah, no, that's awesome. And I think, like I was just talking about going through the experience, having a source of education too, I think is so critical, because even in my position, I'm a healthcare attorney, right? I deal with providers all the time. This should be something so easy for me to navigate, right? And even for me, it was, you spend half the night up Googling all this stuff, like, oh my gosh, this is going to happen to my child, this and this and this, and I have too much coffee or like whatever. And, you're reading all these blogs from Susie in Oklahoma or whatever. Right. Is this reliable? I have no idea. I don't have one source really to go to for those questions. And then you go to your provider and they act like you're crazy, right? Oh, why are you worried about this? This is so random or whatever. So I think having that resource, and again, I think about my experience, and I'm so lucky and I have a great job. I live in a great neighborhood. I have all these wonderful things. And it's like, I still found it confusing. So I can't imagine having, where you can't find transportation or babysitters or whatever. I mean, it just opened my eyes to how, I still can't imagine how hard that would be, but it gives me a little more insight into that.
Those are great points. And I don't think our physicians want us getting our healthcare from Google, Andrea.
All of it. And there's so much, I'm like literally up all night long, just Googling who knows what.
Yeah. I've done it too. But it does have the potential to help educate patients accurately and to engage patients and to also break down the silos of healthcare. So Sara, I would love your perspective on the role in digital health on driving value-based care and better outcomes and patient experience.
Yeah, so I think over the last several years, we've seen this big shift of value-based care. And the whole notion is that we're taking the risk from like the kind of the top of the food chain as the payer and shifting it down to providers. And what we did that, and we really didn't give providers any tools. Some of them did it really well because they either had those tools or they figured it out really quickly, and others are still struggling with that. And others are too small to really invest and would like to participate, but just can't catch up enough to invest whatever it takes to like get their practices ready, get them, get the infrastructure in place that they would need. And so I really think that's the huge opportunity for digital health and value-based care, is that we can come in and really manage a lot of that. We can help those providers to like do things, reporting and, back end feedback. And the biggest thing though, I think we can help with is patient engagement. And that is of course the hot buzzword for everybody right now, is how do you engage patients? And because gosh, patients right now with everything that's going on, like they have too much to think about. We have to make it really easy for them, convenient, interesting, and fun, to your point, Andrea, you like, how do we parse out the all night Google, like doom scroll and make it something that's targeted for them, that really is relevant to them, helps them understand their issues best and can it's very custom to what they need. So to me, that's really, we're sitting between the payer and the provider, trying to optimize like the patient's involvement in that. So we think we provide continuity, and we also think that this adds value and doesn't make an additional layer of complexity, but instead adds value to the whole process. And then to the extent that there's value, we share in that with the payer, but we also actually share a portion of our value with the providers. And we have sort of different models of that. Some providers are small, so we're trying to do that in a way that's appropriate, that rewards quality and efficiency without making it too capital intensive or too much downside risk for us or for them. So we feel like we've built some structures that help us do that. My job as the actuary is to measure improved outcomes and then make sure that we can all win financially from that. So we think that our solution does that. But I've worked with several digital companies in my consulting life. And I think all of them have a really interesting niche that they can fill. And the question is always, is that worth enough to a payer to pay attention to? And number two is the patient going to be engaged with this? And how are you engaging the patient in the best way?
That's interesting. I was going to ask you next, Sara, about some of the challenges. And you've just described challenges for the patients, for the providers, and for the payers. And so I'm interested in what you're excited about and how you and your role as an actuary and you and your position in this new digital health tech-enabled patient engaging platform, which I'm very excited about, can help solve for some of those problems.
Yeah, well, I think, one of the things that I think about all the time is data. And as you all probably, you hear about this, but data is a huge challenge. And it's also a huge opportunity right now. So, we since we don't own data as the digital health company, we want to get our hands on it. And when we have gotten our hands on some and are really, we get really excited. And I think, payers are challenged because they can't they have to be very careful about how they share data. And I've worked for a payer, I know this. And at the same time, it's like, so where can we find that sweet spot of HIPAA compliance and meaningful use, but without like oversharing and giving too much. So we work through that with every payer that we work with. And I think the other element of data that's also really a really cool, exciting opportunity is data that addresses health equity, like we talked about earlier, and social determinants data. That is a kind of a budding industry, really. There are tons of organizations that are starting to do this. We're exploring those. We're also exploring just home growing our own, different data sources that we can marry in. I mean, our goal is to integrate, payer claims data, EMR data, and then all of the data that we're bringing in from our app, things like, patient information and patient engagement numbers, survey data. We're surveying our members constantly about different things, and especially about their providers and their payer experience, so that we can give that back to the providers and the payers and share with them, hey, here's what we're hearing from your members. And we're constantly updating that. And so we're trying to build that sort of continuous learning loop that lets us get better at what we're doing, but also so that we can share with our partners and report, in a meaningful way that helps them get better too. But really in terms of equity and social determinants data, we're collecting that. And we think that, to the extent that we're able to share that back, we will. But we're also using it to understand and kind of build our own, artificial intelligence models around how that will, how is that influencing care? And then how can we get better at it? One of the interesting things related to data, and I work on a health equity work group. We've talked about this a lot, is how do you use health equity to improve quality and improve equity without watering down sort of the quality, because you can, for example, a physician group has a particularly vulnerable population. Do you give them a pass or a lower quality target just because they've got this vulnerable population? And if you do that, are you compromising the care that those folks are getting? I mean, that's at the end of the day, it's all about the patient and the member, and you don't want to be doing that. So I think a lot of us actuaries in this field right now are struggling with that. And how do we address it? And how do we do it in a way that's ethical and responsible?
So challenges all around, but It's exciting to hear how you all are addressing those. Thank you.
Yeah. Yeah. Yes, for sure. For sure.
Super interesting. Well, thank you, Sara, for being a guest. This was a fantastic conversation, really interesting, great way to spend my morning. And so we're going to be posting our vidcast on YouTube and our social media pages. And you can subscribe to our podcast on Apple Podcasts and Spotify or whatever you listen to your podcast on. And thank you, everyone, for listening.